Ever find yourself Googling your baby's symptoms in the middle of the night? I'm Dr. Nathan Chomilo. I'm a general pediatrician and I've seen a lot. Here are some of the top reasons parents search the internet with questions about their child's health. But these questions come with answers you can trust. Let's jump in. It's 4 a.m. and your child has a fever. What do you do? First, let's make sure they actually have a fever. What temperature qualifies? If you do the thermometer reading orally or by mouth, it's anything above 99 degrees Fahrenheit. If you do the reading rectally or in their butt, it's anything above 100.4 degrees. Let's talk about infants. So for children less than 2 months old, we worry if they have a temperature over 100.4 because that can be a sign of a serious illness. The good news is that most of the time, children will recover and be just fine, but we do want to see them as soon as possible. And so if your child does have a temperature above 100.4 and they're less than 2 months old, please contact your pediatrician as soon as possible. Thankfully, usually they are okay and don't need any urgent care. So let's talk about fever in older kids. You might be wondering, how high is too high? Well, in older kids, fever alone usually isn't enough to bring them into the doctor. Fever can be a sign of many things, not just being sick with a virus or a bacteria. And so you also want to be looking at how a child is feeling and acting while they have the fever. If a temperature is above 105, we generally want to see that child as soon as possible. Signs that a fever might be causing a child to feel ill is they have less energy. They might complain about headaches, pain in other parts of their body, or they might just be sleeping all the time. So sometimes a fever is okay. If your child is otherwise acting well, bouncing around the house, and has a fever, that's something that you can just watch. You don't even need to give a medication for. But if they aren't feeling well, if they have a fever and a cough, if they have a fever and they're really tired, giving them some medication and seeing how they respond might be a good first step. It would be very rare to call 911 or have to go to the emergency room for just a fever. It's really a fever and a child feeling ill some other way, whether they're coughing, struggling to breathe, having headaches, that if it's a really high fever, over 105, then you would want to go and seek medical attention as soon as possible. If you're looking for medication to treat your child's fever, you can start with acetaminophen or ibuprofen, which are common over-the-counter medications that can be safe for most children, but you will want to talk to your doctor about what is a safe dose for your child. We've put together these very helpful charts on child dosing guidelines for both acetaminophen and ibuprofen. It's a lot to take in, so we'll link to them down below in the description of this video. If you find this content helpful, please subscribe to the AAP YouTube channel for more. One note about giving over-the-counter medicines. Call your pediatrician right away if your child throws up a lot or gets a rash after taking any medicine. They might be allergic to it, and never give your child aspirin unless prescribed by their doctor. There are a lot of different things that can cause rashes. So how do you tell if a rash is nothing to worry about? Well, rashes that cause pain, that cause peeling of the skin, that start to cause open sores, or are associated with symptoms like fever should get checked out as soon as possible. There's other things to consider with rashes as well. Were they recently swimming and irritated by the pool water? Were there new detergents used at home to clean the laundry? Did you try a new lotion or cream on their skin? Were there other children in their daycare or school that had a similar rash and got sick from it? Or have they been out hiking? Or do you see signs of bug bites, especially one that creates a rash that looks like a bullseye? These are other reasons where it'd be good to talk to your pediatrician about the rash. Let's talk about colic and how tough it can be on babies and parents. First, I want you to know it's going to be okay. As your baby grows, the colic and fussiness will get better. Unfortunately, there's no one solution for every baby that has colic, but there's several things you can try. Things like steady rhythmic motion or rocking, things like trying a pacifier or doing tummy time. Tummy time is what it sounds like. Placing your child on their stomach and letting them kick and push to gain strength in their neck, back, and core muscles. Also trying to lay them on their back and bicycling their legs, or swaddling can help. It's okay to swaddle until the child is 2 months of age or they start rolling, at which time you want to take their arms out of the swaddle. Additionally, some children experience colic because of things in mom's diet if they're breastfeeding. And so thinking about eliminating dairy or caffeine from mom's diet if breastfeeding can potentially help. Sometimes it can be hard to tell the difference between colic and what it's called reflux. Reflux often presents right after eating. A child may arch their back, get really red in the face or angry, or even scream in discomfort during feeds. If that's the case, there's different strategies to try. Strategies like feeding them slower, taking breaks, not wearing tight clothes, or giving them time on their stomach before they eat instead of after. If you or your partner are struggling with your child's colic, please give us a call. Talk to your pediatrician. We're here to help answer your questions, help you know if it's something to worry about or not, and give you tips that might help. And parents, it can be hard taking care of a child dealing with colic. I've been there. It's important to remember to take care of yourselves. Watch out if you're feeling stressed, anxious, or depressed, and don't be afraid to ask for help. And if your child's crying is too intense, it's okay to take a moment, lay your baby down on their back in a safe place, and step out for a moment to take a breath. Let's just say it. Poop! It's no one's favorite topic. And parents, we just have to deal with it. I get questions about it a lot. Is this color poop okay? Is my child pooping too much or not enough? When it comes to poop, what I talk about is earth tones. If the poop is earth tones, we're good. Brown, yellow, tan, green, that's all okay. If poop is red, if it's dark black or white, those are reasons that you're going to want to talk to your pediatrician. It is important to notice if they recently ate something that's red or maybe started a new medication. That might impact their poop. That's a reason to talk to your pediatrician, but you don't need to call 911 or rush them to the emergency room with one odd-looking poop. Newborn babies' poops can often look black, and this is called meconium. This usually lasts only for the first few days, however, and then goes to transition stools, which are usually more yellow and seedy. Parents ask about how much kids are pooping, a lot or a little, often. For most kids, if their poops are soft and not causing any pain, how often they poop can vary. We worry if they're pooping more than they're eating, that they might be having diarrhea. If your child has been experiencing diarrhea for 12 hours or more, then we want you to call your pediatrician and talk about next steps. If it's been more than 5 days since your child has pooped, or they're complaining about pain, either when they poop or they complain about things like stomach pain or eating less, then we worry about constipation. And when babies are transitioning from breast milk to formula, or from formula or breast milk to solid foods, it's normal to see changes in the stool. Stools can become more loose, or they can become more firm or more hard. Most of these changes start to resolve after a few days. Hearing a baby sneeze can be cute. Hearing a baby cough can be scary, especially if the cough is persistent. So how do you know when a cough is minor? Cough can be a normal part of a body clearing a cold. A cough that doesn't interrupt breathing, that doesn't interrupt feeding or sleep, is usually a minor cough. Minor coughs usually last 2 or 3 days. But if a cough is persisting for more than 3 days, then it's time to call your pediatrician and talk to them. There are certain types of coughs that we do worry about. Coughs that are barky or harsh. Coughs that make it hard for a child to breathe because they're coughing so quickly and for so long. Those coughs should prompt you to talk to your pediatrician right away. If a child is having a cough and trouble breathing, that's a warning sign. When we talk about trouble breathing, they are working really hard. Imagine if your child just ran a marathon and you could see them moving up and down, trying to pull in air, or their skin around their lips or their fingers or their feet starts turning blue. Those are signs that this cough is serious, and your child needs to be seen either by calling 911 or going to the emergency room as soon as possible. And if your child has a cough and a fever, that's another reason to talk to your pediatrician as soon as possible. When it comes to cough medicines, don't give them to children under 4 years old. If your baby is older than 1, you can try honey instead. We have a link in the description of this video to more recommendations on how to treat coughs. We'll also link to a graphic that shows a baby with RSV who's having clear trouble breathing, so you can know what that looks like too. Infantile spasms. A lot of parents go searching the internet for this, so if you have questions, you're not alone. Infantile spasms are a form of epilepsy that occurs in infants. The condition was first called West syndrome. First off, it's rare. Only about 1 in 2,000 children get it, but the signs can be subtle. A sort of sudden, repeated, jerky movement, followed by a surprised look on your baby's face. These often happen in a series, about every 5 to 10 seconds. If you suspect your baby might be having infantile spasms or seizures of any kind, you should call your pediatrician right away. Early treatment is important. It might be helpful to take video to show your doctor, but your number one priority is keeping your child safe during the episode. Most seizures will stop on their own and do not need immediate medical treatment. But if there's trouble breathing, blue skin, or the seizure lasts more than 5 minutes, call 911. The good news, infantile spasms and many other forms of epilepsy are highly treatable. About 2/3 of children with epilepsy outgrow it by the time they're teens. Parents, you're not going to know all the answers, and that's okay. It's also okay to call your pediatrician whenever you have a question. It's what we're here for. Take what you find on the internet with a grain of salt. Check to make sure it's from a reputable source, like the American Academy of Pediatrics. If you want to read up on any of these topics, we have links to healthychildren.org articles in the description below. These are resources vetted by the AAP, so you know it's content you can trust. I'm Dr. Nathan Chomilo. Thanks for watching. If content like this is helpful, please hit that like button to let us know.